Now we start with the latest on the coronavirus situation in South Korea. Despite a dip in the number of confirmed cases, local health authorities are on alert over a potential uptick in new infections as we move deeper into the week.
For more on that, joining us live in the studio this week is our Shin Ye-eun. Good morning to you, Ye-eun.
Good morning.
Let's start, as we like to do, with the daily figure forecast for Tuesday. The exact tally is yet to come out. Normally comes out around 9:30 a.m. Korea time, but how's it looking so far?
Well, we're expecting to see the numbers stay below 2,000 and maybe even as low as the 1,300s. And from midnight to 9 p.m. yesterday, a total of 1,274 cases were reported. That's 241 cases less than at the same time the previous week. And among local infections, over 72% were from the Greater Seoul area.
Now, Tuesday's caseload would have most likely dropped compared to last week when it was over 2,000. But authorities have warned that this number could easily go up later in the week.
Right. We cannot forget that we've just spent another 3-day weekend last week after the country also had a long weekend. The reported daily tally quickly jumped from the 1,500s to the 2,000s. And that's because during the weekends, not a lot of people visit COVID-19 test centers. Authorities also expected many to have traveled across the country to enjoy the long weekend. And that's why they said that they would carefully monitor a potential uptick in COVID-19 cases this week that would actually show just how much the virus spread over the 3-day weekend.
Now let's move on to the vaccination front. That's front and center in many people's minds. We hear now that finally this milestone the South Korean government has been talking about for ages now. 7 out of 10 people in South Korea have now received at least one shot of a COVID-19 vaccine.
Right. South Korea on Monday saw 40 million people vaccinated with at least one jab. And the country achieved this major milestone just 228 days since they first started inoculations. And as for the adult population, more than 90% have received at least one jab.
Well, yeah, and we're also hearing that booster shots will be administered beginning today. Who are eligible?
Right, so medical workers will be the first in line to receive these booster shots. And to give you more details, some 45,000 medical staff that have been working on the front lines fighting against COVID-19 are eligible. Most of them actually received their second dose of the Pfizer vaccine back in March and April. So their booster shot will be a Pfizer shot, which they can receive by October 30th at the medical facility they work for. Next up will be seniors aged 75 and up, or those who work at relevant facilities like nursing homes and that have received their first jabs from April. And this aligns with the WHO's recent recommendation that people with weakened immune systems should be given a booster shot. A panel of WHO vaccine advisors called the Strategic Advisory Group of Experts on Immunization specifically cited people over the age 60 who have been inoculated with Chinese vaccines like Sinopharm and Sinovac should especially get an extra shot because studies in Latin America showed that they did not perform as well over time.
And we have some more good news away from just vaccinations. We're hearing that the US drug maker Merck is far down the line in the development of an oral treatment against COVID-19. It's actually seeking emergency use authorization from the FDA. So tell us more about this.
Right, so we've now entered a phase in the pandemic where we need to think of living with COVID-19, and that's why a lot of global drug makers around the world are trying to make COVID-19 pills. Representatively, U.S. drug maker Merck has developed an antiviral pill called Molnupiravir. On Monday, Merck asked U.S. regulators to authorize its pill for treating patients with mild to moderate COVID-19 infections. And if approved, it would become the first oral medication for COVID-19. Now, Merck has stated that its vaccine lowered the rate of hospitalization and death by 50%.
Now, we hope to see some progress on the vaccines and the pill development very soon.
We certainly do, and we'll be seeing you at the same time tomorrow. Thank you very much for your reporting.
Thank you.